So I'm going to be talking about transgender health and in particular social determinants and how they impact transgender folks. And I'll be talking a little bit about a process that we went through to try to address some of those negative impacts of social determinants. So I'll start with going over briefly some estimates of HIV prevalence in Los Angeles County. Then I'll talk about social determinants of health, and then we'll focus on the Getting to Wellness process. So I don't know if you all can see that back there, but in 2012, DHSP put together a very helpful report on the estimates of transgender population estimates. And they basically convened a group of stakeholders and looked at the really the limited data that there are with respect to how many transgender people exist and how we can best estimate prevalence based on that. And so what they determined was that they estimated to be roughly 14,000 transgender people that live in Los Angeles County, and that the HIV prevalence rate among them for transgender women was 15.1%, and for transgender men it was 0.6%. So obviously 15.1% in particular is pretty alarming when you think about HIV prevalence in any community. What's even more alarming really is when you look at the numbers when they're stratified by race and ethnicity. So this was also in the DHSP report. This is a table, estimated HIV prevalence by race ethnicity among transgender women in particular. And what they found was, again, pretty staggering, in particular with Black African American transgender women, a 48.3% HIV prevalence rate. So 48.3%. And then, for Native American women, 26.9%. So we've talked a lot, I know we all talk a lot about social determinants of health, and people are probably pretty familiar with this definition or some variation thereof. Social determinants of health are the circumstances in which people are born, grow up, live, work, and age, as well as the systems put in place to deal with illness. This comes obviously from the World Health Organization. So we're gonna kind of zero in a little bit on those categories of people, the circumstances in which transgender people in particular are born, where they grow up, where they live, work, and age, and how that impacts their health. So to do so, we're going to look at a report that, again, some of you may be familiar with. It's called Injustice at Every Turn. It was a report put together by the National Center for Transgender Equality and the National Gay and Lesbian Task Force in 2011. If you haven't seen it, take a look at it. It's really impressive. So this is a national report. That's not to say there are not data locally, because there are some good data locally. We know one of the challenges is that there's just not enough of it anywhere, really. But I'll focus a little bit on some of the reports that have come out locally. But pretty much what we find nationally is, I think, what is reflected here in Los Angeles County as well. So this particular report, again, this was a 6,450 transgender identified people across the country responded to this particular survey. And what we found, again, going back to the definition of social determinants of health, when you think about circumstances in which people are born, I think the first thing you think about when people are born is that they're born into a society that, this gender kind of binary, where you're born male, so you're a boy, you're born female, so you're a girl. End of story. And obviously, so then trans folks are born into the system where they're basically invisible. Their identity as a transgender person is invisible. When it does become visible, it's not, there's a lot of negative impact for them. So in this study, they found another interesting fact with respect to when you're born into a family. 57% of the participants experience significant family rejection. And that's pretty important. Especially, I know it's hard to see, but this table here also kind of demonstrates the impact of family acceptance. So when families reject folks, the trans people will experience a lot more homelessness, a lot more incarceration, they will be forced to work in underground work, they will have attempted suicide, and also have more experience with drugs or alcohol. So obviously we know that the impact of family acceptance is very significant. Also, when we think about the circumstances then where people grow up. So when I think of growing up, I think of a lot of us grew up in a school, at least, spent a lot of time in school, and that very much shaped our being. And then when you look at the statistics for the transgender respondents here, that 78% reported being harassed at some point during kindergarten through 12th grade. 35% of them reported being physically assaulted in a school setting, 12% reported being sexually assaulted, and 6% were actually expelled. And another thing to consider here is that for up to almost 1/6 of the respondents, they were forced to leave a school setting as a result of harassment. So, again, shaping especially people in their early childhood and their early lives. You have to leave school because of who you are. It doesn't really set you up for success and for health or wellness. Circumstances in which people live. One example here is, we live obviously in housing, and this is a table that shows people who were denied a home or apartment, and this is by race also. And then I should add, they were denied a home or apartment because they were transgender. And so you can see among American Indian respondents, 47% reported that they had at some point been denied housing. 38% of African American and Black respondents said that as well. So overall, 19% of the sample reported discrimination from being denied a home or apartment. So also when you think about people's living experiences, you think of their experiences accessing services, accessing medical care. So this is, I'm not going to go through all of this, but basically this is experiences of discrimination and violence in public accommodations. And one of the things that really jumped out for me was this doctor's office or hospital, where 24% of the respondents said that they were denied equal treatment, and 25% said they were harassed or disrespected in a doctor's office or hospital. I think this is important to think of too. I mean, obviously with ACA, there's a lot more access for a lot of people, and there's going to be less discrimination. But discrimination is one of those things that it happens subtly as well. And another finding in this report was that a lot of transgender people said that they had to educate their healthcare provider on what it meant to them to be transgender, what they needed, what they didn't need. So there's a lot of work to be done in healthcare settings. Just because people can get healthcare doesn't mean, as we know, it's quality healthcare. Circumstances in which people work. So this is the unemployment rates for transgender adults by race. And for the general population, unemployment was, at the time of the study, 7%. And for the transgender participants, it was 14%, so it was double the rate. Among Black respondents, it was 28%. Native American, 24%. Percent having lost a job because they are transgender, also by race. 36% of the Native American respondents said that they had lost a job because they were transgender. Overall, 26%. So again, you can see this, obviously there are disparities by race in addition to just disparities overall. Again, we talk a lot about syndemic in Los Angeles County and elsewhere, a mutual reinforcing interaction of disease and social conditions. We really see this also in this study and just in our work with transgender folks. So in particular, respondents who had lost a job due to bias compared to those who did not lose a job due to bias experienced 4 times the rates of homelessness, 70% more current drinking or misuse of drugs, 85% more incarceration, and more than double the rate working in the underground economy, and more than double the HIV infection rate. So again, everything just kind of, all the negative impacts are amplified. One thing I guess the good news that this report kind of depicts also is that there's a lot of resiliency. I think you find this in most communities that have experienced a lot of discrimination and oppression, and this is one example of the resiliency that transgender people, at least those that responded to the survey, demonstrated. So this is a table, a graph with respect to their status as a student by age group. So among 18 to 24-year-olds in the general population, it's estimated that 45% are a student of some sort. In the transgender population among 18 to 24-year-olds, 37% are a student of some sort. So that kind of makes sense given what we talked about earlier, the discrimination that happens in schools. So if you're 18 to 24, maybe if you're transgender, you're less likely to be in a school setting. But the good news here, and the resiliency I think that's demonstrated, is that when you move into the older age ranges, among the 25 to 44-year-olds, 7% of the general population identify as students, but 22% of the transgender population identify as students, which I think means that people, we don't give up. There's barriers, there's obstacles, but people are determined to be themselves and to succeed. So I think this is and there's other kind of examples of resiliency that were documented in the report. So again, this is one of the local studies that happened a while back. Dr. Reback from Friends and her colleagues put together this report in 2001, the Los Angeles Transgender Health Study. And just again to say that there are many things that have happened locally that are impactful in studying trans people. This report found 50% or more of the transgender women. There's about 245 transgender women that they studied. 50% or more reported a history of incarceration, had relied on sex work, didn't have health insurance, had injected some hormones or silicone or oil, and had been higher on alcohol or other drugs while having sex in the last 6 months. So it's reflected locally. So all that to say, again, this is kind of the picture, and we talk about social determinants and how it impacts transgender people in particular. But the good news is that there's been a lot of things that have happened locally, a lot of efforts that have happened over the years locally. And so some of the work that has included the TSPN has done a lot of great kind of groundbreaking work to provide effective services. One of the things that's happened more recently, I have to say, Mario Perez at DHSP convened a meeting in 2011 of community stakeholders to basically express DHSP's priority for understanding how HIV in particular is impacting transgender folks, and wanting to really prioritize some form of a wellness center for trans people, but wanted community buy-in, needed community buy-in to kind of make that happen. So as a result of that meeting that happened 3 years ago, the Transgender Service Provider Network developed some recommendations, did some preliminary work, developed some recommendations, and then CHIPS was able to secure funding through NIH that basically kind of took that work to the next level, and we were able to convene. Keisha and I had the privilege of convening and working with a consortium of 14 individuals, the majority of whom identified as transgender, to put together. We had a very short kind of window of time, but we wanted to put together a full kind of comprehensive picture of social determinants and other things that were impacting trans health, and what are some best practices and models with respect to transgender wellness. So we put together this report, came out a year ago, Getting to Wellness, a roadmap for improving the health of trans individuals in LA County. The vision of the consortium is to ensure the health and wellness of the community in LA County by responding to the immediate needs of individuals while creating an environment where transgender people can flourish. So real quickly, these are some of the implementation principles that we came up with. I think one of the important things here is to address individual and environmental needs with equal effort. Recognizing that we don't want a wellness center that just focuses on behavioral risk reduction type of interventions. We want something that really kind of addresses all of these, as many social determinants as possible. We came up with 3 models. I won't go into a lot of detail, but basically I think what we wanted to do was always develop some kind of a wellness center, and then figure out what some standards were for either primary care or housing or just primary care. What are some quality standards that we could demonstrate, that we could develop the standards, we can choose a couple organizations for demonstration projects, evaluate those standards, and then diffuse it across the county. And a couple of the models were with respect to that, and the last one was on kind of decentralization. So we really didn't necessarily want one kind of brick and mortar wellness center. We thought it would be helpful to have kind of a decentralized model where people could access services at different places. So it's really about kind of diffusing best practices. So there's more to be said about the process. It was a great process, and I think the reports are I don't know what DHSP, I think there's a RFP in the works based on this and other work, but hopefully we'll hear about that soon. And that's my story.